Welcome to another Spotlight video where we guide you through the congenital heart defects spotlight in your text. After watching this video, you should be able to describe the anatomy and physiology of congenital heart defects, structural malformations of the heart present at birth. Have you ever wondered just what exactly is a heart murmur? To begin our understanding of congenital heart defects, review this image of how blood normally flows through the heart. Remember, deoxygenated blood, shown here in blue, returns from the systemic circuit, flows into the right atrium, past the tricuspid valve, and into the right ventricle. The right ventricle contracts to propel blood past the pulmonary valve, into the pulmonary trunk and pulmonary arteries, towards the lungs, and into the pulmonary circuit. Richly oxygenated blood, indicated in red, then returns from the lungs via pulmonary veins and into the left atrium, past the mitral valve and into the left ventricle. Finally, the left ventricle contracts to force blood past the aortic valve and into the aorta as this now freshly oxygenated blood returns to the systemic circuit. The spotlight image here discusses a series of congenital heart defects, although many other examples occur. Let's highlight three of the conditions presented in the spotlight. One condition, patent foramen ovale, is discussed in the first row. Patent means open, so in this condition, the foramen ovale, which is open during fetal circulation, remains open after birth. Blood in the left atrium flows abnormally into the right atrium due to the higher pressure on the left side of the heart. Notice the red color within the aorta indicating that systemic arterial oxygen content is normal in this left to right shunt because blood does not bypass the lungs. So, this is not considered life-threatening, however, it may still require treatment. Remember, the foramen ovale is open during fetal circulation, normally closing after birth, resulting in a closed foramen ovale or fossa ovalis, which can be seen in adult hearts. Tetralogy of Fallot is a complex of 4 defects of the heart. Tetralogy means a set of 4 abnormalities that occur together. These include a narrowed pulmonary trunk, which is called a pulmonary stenosis, a hole in the wall between the ventricles called a ventricular septal defect, the aorta arising from both ventricles as opposed to correctly connecting to only the left ventricle, and a thicker or hypertrophied right ventricular wall in response to an increased workload from this condition. In transposition of the great vessels, the pulmonary trunk and aorta are anatomically switched in position, or transposed. The aorta is connected to the right ventricle instead of the left ventricle, and the pulmonary trunk arises from the left ventricle instead of the right ventricle. As shown here, the result is low oxygen blood entering the aorta and then into the systemic circulation. Immediate surgery is required as this condition is incompatible with life, meaning life is not possible. Apply what was discussed earlier to answer the following question. A mother is told her newborn baby has been diagnosed with patent foramen ovale. She is confused because she is unfamiliar with this term and asks for an explanation. Which of the following is the best description to use when describing the baby's condition to the mother? A. The baby has a blood vessel arising from an incorrect heart chamber. B. The baby has an opening between the atria, the upper 2 chambers of the heart. C. The baby has a complex condition of a narrowed heart vessel, a hole between chambers, and an enlarged heart. If you answered B, the baby has an opening between the atria, the upper 2 chambers of the heart, you are correct. In patent foramen ovale, the fetal opening between the left and right atria remains open or patent. In summary, congenital heart defects are structural malformations of the heart present at birth. They range from mild to serious, and examples include abnormal holes between the chambers, such as patent foramen ovale, Tetralogy of Fallot, a complex group of 4 heart malformations, and arteries arising from incorrect chambers, such as in transposition of the great vessels. These conditions can result in circulatory patterns impacting blood oxygenation levels or stressing the heart to adapt by enlarging. So what? Why is it important to understand congenital heart defects? Well, this knowledge is crucial to healthcare providers. The resulting blood flow pattern change in the heart results in abnormal sounds called murmurs that can be detected with a stethoscope. Each congenital heart defect has a different sound, as a patent foramen ovale sounds different from a ventricular septal defect. Knowing normal heart sounds and blood flow patterns can help identify a congenital heart defect, distinguish among them, and determine the severity of the condition. All are important steps in patient care and treatment.